Good morning, everyone. Thank you for being here today. My name is Henry Akufleman, and I'm very pleased to present our analysis of influenza-related death in the United States from 2009 to 2017. This storyboard outlines key insight into temporary trends, geographic distribution, and impact of demographics on flu mortality. And our ultimate goal is to leverage these above mentioned insight to improve our staffing strategies during peak flu seasons. Now that you have an overview of our topic, let's dive into why this project is so crucial. So one may ask why this project is so important. Now, influenza season places enormous strain, as we all know, on our healthcare system, especially when vulnerable populations such as the elderly are affected. So this project was initiated to analyze historical trends in flu cases and death so that we can develop a data-driven staffing plan with accurate predictions so that we can better allocate staff in high demand areas and also ensure that hospitals are well prepared and are not caught off guard. So today we will answer three questions. First of all, how our flu death change over time? Secondly, which regions are most affected? And then the last will be what role do demographics play in these trends? So with the importance of our project established, now we will look at the data that shows how flu deaths have evolved over the years. Let's start by looking at our temporal analysis. So this line chart now displays the annual trend in influenza death from 2009 to 2017. So if you look at this closely, you will notice significant fluctuations over the years. For example, in 2013, we see that there is a spike indicating a particularly severe outbreak in California. So this visualization now answers the question of when severe flu seasons occur. So recognizing these temporal peaks allows us to forecast future high demand period and also plan our staffing levels accordingly. Now, let's shift our focus from time to location to see how the flu impacts different regions across the United States. Here, you see a cohort map that visualizes flu-related death by state. The darker blue shades indicate high mortality rates, like California and New York constantly appear as high impact areas, whereas states such as Alaska and Vermont also show lower mortality figures. This map answers the where question by highlighting regions that are most affected. When we overlay this with the data on vulnerable population, it becomes very clear that areas need extra staff and support during flu season if these areas are mostly populated by the vulnerable or the elderly. Now, having explored the timing and now the geographic spread of flu death, let's now explore what drives these high mortality rates. So, on this slide, we dive into the connection between demographics and flu mortality. Here, our scatter plot examines how the percentage of population for the elderly and older relates to total population death across different states. Notice now that as the proportion of elderly residents increase, so does the number of flu-related deaths. This clear correlation now tells us that states with a larger elderly population are more vulnerable during severe flu seasons. Now, understanding this relationship is very key for our strategic planning. It highlights that demographics play a very significant role in the impact of flu outcomes. So with this insight, we can focus our effort on high-risk regions by ensuring that states that have elderly population will receive enhanced public health measures such as increased vaccination outreach. So in summary, this correlation analysis not only quantifies the risk associated with an aging population in a particular state, but also directly informs us how we should allocate resources going forward. Now that we've looked at demographics on their own, let's now also integrate these insights with our temporal data to see the full picture. Now, let's integrate our findings from the line chart, that is the temporal analysis, and the correlation analysis. Now, let's integrate our findings from the temporal and correlation analysis. On one hand, our line chart indicates the when, showing the peaks in flu mortality. On the other hand, our scatter plot reveals the states with a higher percentage of residents age 65 and older tend to also experience high flu death. This combined insight tells us that during severe flu seasons, areas with large elderly populations are disproportionately affected, which means that states with the elderly population are most affected in terms of high mortality rate. So this understanding is crucial, additionally, for staffing and implementing targeted public health measures such as enhanced vaccination rate in the high-risk areas. With this integrated insight, let's now consider the real-world challenges in our healthcare and also what the challenges that our staff face on a daily basis. So our temporal analysis shows that the flu-related death varies significantly from year to year, and then with distinct peaks during severe outbreaks. Our spatial analysis indicates that certain states, especially those with large elderly population, consistently experience higher flu mortality. And thirdly, the correlation also shows that the percentage of resident age 65 plus and flu deaths further emphasize demographic are crucial factor in flu severity. And fourthly, also qualitative feedback also confirms ongoing staffing challenges. So based on the above insight, now we recommend that we have to prioritize staffing in high-risk states, forecast staffing needs, enhance vaccination outreaches, and also optimize scheduling, that is, develop flexible staffing models to prevent burnout and ensure continuous coverage. Thank you for your attention. And at this point, we would like to welcome questions and comments you may have regarding these findings and recommendation. Thank you very much.